One of the most prevalent comorbidities in patients infected with SARS-CoV-2 is diabetes. Type 2 diabetes mellitus, or in short, T2DM, is associated with worse outcomes for COVID-19 patients. Commonly used glucosilin medications such as metformin, DPP4I, or insulin were found to have an impact on the level of inflammatory cytokine, which potentially influence the clinical outcomes in SARS-CoV-2 infected patients. Hence, we conducted this territory-wide retrospective observational study evaluating the clinical improvement, virality, acidosis, hypoglycemia, acute respiratory distress syndrome, and composite clinical outcomes associated with the aforementioned medications for hospitalized T2DM patients with COVID-19 infection. A total of 1,096 T2DM patients hospitalized with confirmed COVID-19 in Hong Kong were included. The exposure was defined as receiving a glucosilin drug class within 3 days of admission. Any patients without receiving a glucosilin medication within 3 days of admission are considered as control. Baseline covariate between the two groups were balanced by multiple imputation, followed by inverse probability of treatment weighting for propensity score. Multivariable Cox proportional hazard models were performed to estimate hazard ratios and the 95% confidence intervals of time to event outcomes. After propensity score weighting, baseline characteristics between exposure and non-exposure groups were generally balanced. Metformin uses were associated with quicker time to clinical improvement, hospital discharge and recovery, shorter hospital length of stay among survivors, lower risk of composite outcome, and reduced cost from day 30 to day 90 when compared to non-metformin uses. Shorter hospital length of stay was also observed in DPP4I users compared with control. DPP4I users incurred significantly lower cumulative healthcare costs from day 0 to day 30. Insulin users have greater risk of hypoglycemia during admission when compared to non-insulin users. In conclusion, metformin and DPP4I have exhibited association with improved clinical outcomes, while insulin has proved to be associated with increased risk of hypoglycemia. Due to the observational nature of our study, a definitive recommendation of metformin, DPP4I, and insulin administration in the presence of this ongoing COVID-19 pandemic is not feasible. In view of the importance of glycemic control, efficacy, and safety of all the drugs investigated, patients who receive these glucosilin medications are not warranted, and modification of drug regimens for diabetic patients with COVID-19 should be carefully considered.